Okay. Hi, my name is Emily. I am the Associate Director of the Study Abroad Office, and I am really pleased to introduce Professor Bandoni Muench, who is here to talk about a winter intersession program we're hoping to launch for this winter intersession.
Okay, thank you very much. I'd like to welcome everybody, and I always like to start out with what brought you here. Of all the possible kinds of study abroad experiences you might have signed up to find out more about, why this one? So you can put it in the chat, you can speak up, whatever's more comfortable for you.
I'm just really interested in this course, and it also was like one of the first ones I saw that was being offered again, like post hopefully COVID and everything.
Yes.
So I just want to find out more.
Okay, anybody else?
I also was interested in this course normally, and then when I saw the email, I didn't realize it was offered as a study abroad option, and I always wanted to study abroad, so I thought that was really cool.
Good. Okay. Anybody else?
I kind of feel the same way. This course seemed interesting to me, and the location, like Ghana, seems like I don't think I would go there for myself, but just being able to see that area and see what it's like in like a different part of the world, I think that'd be a good experience.
Yeah, that's something I hear pretty frequently, that people, you know, would get on a plane and go to Europe by themselves, but they're not so sure they'd do that with an African country. Anybody else? I'm going to go ahead and share my screen. And as Emily said, she'll have she'll be recording this. I can provide slides. Sometimes parents like to see slides. And I'm just going to lift this up a little bit so I can project.
Yeah, happy to share this with anybody who wants to share it with their parents.
Okay, and so I usually do a short presentation, and these are some of the things I talk about. So study abroad in general, study abroad in Ghana, the course, where we stay, the kinds of things we do, a little bit about costs. Emily will probably help me out with that because she's done the cost sheet for this. And then I usually also do a little bit about some of the pros and cons of study abroad in developing countries, which is great. I think everyone should do it, except it's really, what I really should say there is almost everyone. It's not the right choice for everyone, okay? So employers and graduate schools like to see study abroad on people's resumes for all kinds of reasons. It suggests some cultural competency. It suggests some willingness to adapt, and non-traditional destinations amplify that effect a little bit. So one good reason to consider going to Africa or Asia or Latin America is it's a bigger step, and so it's a little more noticeable on your resume sometimes than a trip to Europe. I've got an upside down map here that shows the distortion of the projection in the maps that we normally see. Africa is actually huge compared to North America, even though on most of our familiar maps it looks small. And so it's a good opportunity to go visit someplace that maybe isn't on everyone's travel list. So a couple more reasons that study abroad in Ghana is a good choice. Ghana is a stable democracy with a long history of peace. Even when it has gone through change, like independence from Britain, that was a peaceful transition. And as you can see from this monument for independence, English is the language of government in Ghana and the language of business. So you can get around everybody learns English in school. School is compulsory. Some people's English will be limited, but everybody speaks at least a little. And so it's also a good place to go because it's got a very rich, vibrant group of cultures, and it's a country that will challenge many of your assumptions about Africa and about developing countries.
Professor Bandoni Muench, the slides aren't moving along. It's kind of just,
Oh,
if you want to,
still on the same one?
yeah.
Weird. Okay. Let me try this.
Again. Yeah. Oh, there you go.
Okay. So let's see if I need to back up any. Oh, I'm going forwards, not backwards. That was the monument there. So you can see the English on it and the upside down map. Okay. So, so we have a shared history, a sad history in the slave trade with Ghana. This is a slave fort, but it helps us understand our history as Americans. And it is an interesting place to study the relationship between health and the environment, because it has recently transitioned from being a low-income country to a middle-income country. And like most of Africa, it's urbanizing very rapidly. So the picture at right is not probably what you had in mind in thinking about going to Africa, but this is very much part of Africa today. It's tropical, and like most tropical countries, it's going through a lot of environmental change very rapidly. So deforestation is happening at extremely high rates. And it's because of the urbanization, it's a good place to study the relationship between environment and human health. That's something that people don't always think about. They don't connect ecology or environment with health. But if you think about malaria, which is one of the most important diseases globally, it's spread by mosquitoes, and things like deforestation can change people's risk for malaria because it creates habitat for mosquitoes, or it might, in some cases, destroy habitat for mosquitoes. So the course is Biology and Global Health, and the prerequisites are just Biology 117 and 119, the normal freshman majors sequence. It's a 4-credit class with lecture and lab, so it counts for the biology major and minor, and it does provide lab credits for the bio major that are sometimes harder to get. And there's a whole long list of other majors and minors that will count it. Some of these you have to petition, but they've been pretty consistent. So biochemistry, environmental studies minor, socio-medical studies major and minor. I think it's actually listed now for the socio-medical studies major. International relations, major and minor, Black studies major, and Africana studies minor. Okay, so global health is populational and it's comparative. So you might think of the focal question as why do people live longer in some parts of the world than others? And why are people healthier in some places than others? Because of the location and the study abroad context, we will focus on environmental health. Environmental health sometimes makes people think about large scale, wealthy country problems like pollution, air pollution, or water pollution, same sort of thing in developing countries. So our most basic survival needs, air, water, food, housing. Ecological change, deforestation, urbanization, climate change. And as you might expect, we focus on problems that are either primarily tropical or primarily typical of low and middle income settings. Middle income countries are really interesting from a health standpoint because they retain some of the issues of poverty while starting to develop some of the challenges associated with affluence. So it's sometimes called the double burden of disease. So there are, in a country like Ghana, both people who are obese because they have too much food available to them, and people who are undernourished because they don't have enough food. So you get both ends of the spectrum. So one of the things we do is carry out a research project on a neglected tropical disease, and we do that in conjunction with a group at the University of Ghana School of Public Health. And this is students in the lab. This is our work out in the field, some of the work. We work with a disease that is transmitted by snails and is a serious problem in children. So we sample the snails. We also sample the kids and see about disease prevalence. We go to healthcare facilities and laboratories and schools and various kinds of NGOs, non-governmental organizations. We talk to different professionals about their research and about current issues and problems. So this is one of our partners. And it's a biology class, so we see some rainforests, some savanna, we see different wildlife like baboons. And a lot of the course, we don't very often just go to a classroom. A lot of our course is going places and seeing things. So we're kind of always going out to places. We might have discussion at breakfast before we go or on the bus on the way there. And then we see something and relate it to the reading you're doing. And then on the way back, we're processing what we saw. So it's very different from, say, the humanities experience where you go and sit in a classroom and then you go out separately. It's much more integrative. We do take planned recreational excursions, and this is partly because people don't feel comfortable for the first week, sometimes even two. Getting out and trying things on their own. So this is an archaeological site that we visit some years. We go to various kinds of cultural and historical sites. We go hiking. Sometimes people have gone to a soccer game. Just we get out and do some things that aren't part of the course, but are fun to do. Okay, now this is where I might need a little help from Emily, because I think I fixed most of these from previous years, but the costs are divided into a couple of different buckets. And my goal here is not to go through the whole cost sheet, but to explain the different buckets of costs. So these shown here are big costs that are mandatory. So you pay a program fee, and that includes your transportation in country, your accommodations, 1 to 2 meals a day, and all of your admissions and required insurance that the college requires you to have. You pay for airfare and you pay for tuition. Okay. Mm-hmm. There are also what we call non-billable costs. And the reason for putting these on is that it's really important that you know that previous slide isn't quite all the money you need. And I would rather that you know and perhaps wait a year to take part than run out of money mid-trip. Now these are very different. They're much broader ranges and less exact. So you will have to apply for a visa. There are some health-related costs. That's not where you want to skimp. And I'll explain those a little bit with a later slide. You have to get yourself to the departure airport. That's probably going to be somewhere in the New York City metropolitan region. And you have a few meals that you need to buy. You're probably going to want to go sightseeing, do some other things. You'll have to have a little bit of that. You know, of course, we don't include your souvenirs in the budget, things like that. And you do have some personal expenses. So for example, I use clothing, and you don't have to go out and buy a whole new wardrobe for this, but because we do spend a lot of time in workplaces, just like for an internship, you need to look kind of professional, and you may not have professional looking clothing that's suitable for 90-degree humid weather. So you might need some different clothes. Now you can go down to the Goodwill and get everything you need for about $25. It doesn't have to be a lot of money. Also included in this is non-billable cost section of the cost sheet is your spending money. That's this category here. And I have to say that for Ghana, it's a little more variable than for some other programs. So I have asked students different years, and in the same year, I have gotten estimates as divergent as $200 for the whole 4 weeks versus $1,500. But that depends on what you buy. In short, if you want to spend very little money, the more you live like a local, the better. So if you buy beans and rice from the little shop on the campus that serves students, you might get your meal for $2, but you could go downtown and spend easily $40 or $50 on a meal, just like in New York City. If you want a beer, if you go to the local pub, you'll spend $1 for your beer. If you go out to a fancy place that caters to foreigners, you could spend $10 on a mixed drink. You know, that's kind of giving you some sense of what you might, the different kinds of experiences and how they might affect your bottom line. Okay. This is where I'm least fluent at the moment. There is scholarship money. You can apply for that, and it sometimes is underutilized. If you're Pell Grant eligible, there's a big scholarship, and people going to Ghana have gotten it. You can use financial aid with some restrictions, and mostly you just have to take 6 to 9 credit hours, and it's a reallocation of your total loan amount, not additional money that you wouldn't be eligible for otherwise.
I'm gonna jump in here if that's okay.
Sure.
So we do have a winter intersession scholarship that's through the Study Abroad office. That is $1,000 scholarship. So you can apply for that on our website. The deadline is November 15th. So you would apply typically after you're accepted. And then definitely you can look at the Pell Grant, the Gilman Scholarship if you're Pell Grant eligible, if you receive the Pell Grant. And you would want to meet with Dr. Michael Mills for that and pay close attention to the deadlines because they're pretty early. A lot of times you do that before you even apply for study abroad, although the application for this program is open. For winter intersession, there isn't extra aid that you would receive for the winter, but you can, what a lot of students will do for a winter intersession is that if you ever turn down aid for the fall, you have up till the very last day of the semester of classes to ask for, accept a loan and use that money towards your study abroad. So that's what a lot of winter intersessions.
Thanks for the clarification. Intersession too for me.
Yeah.
You can use, I think the key point here is you can use your financial aid for it, but you're not getting more money out of it.
Mm-hmm. Exactly.
Yeah. Okay. So to get into Ghana, there's definitely one required vaccine. I suspect there will be 2, one of them being COVID. So you have to have this yellow card here, which is a yellow fever card. You also have to take medicine for malaria. And sometimes that is dictated by your insurance. And we've generally provided students with a visit to the travel clinic. We set it up and you go as a group and it's a little bit discounted, and there are still individual consultations. They get your records and they find out what other health conditions or medications you have that are relevant that would allow them to make a decision on the best medicines for you. Okay. Safety. This is a little bit messy right now because every country has a don't travel because of COVID warning from the State Department. But typically Ghana is rated in the same category as Canada, which is the safest category, actually safer than most European countries. So Ghana has a safer rating for travel than, say, France. Okay. And so what that means is that precautions appropriate to travel and to being in big cities when you're in a big city are appropriate for Ghana. Okay. This isn't the destination I would suggest if you're if a primary concern for study abroad is great nightlife, and but people usually do go out to a club, and so one of the things that I like people to know is that you have to plan that out a little farther. You can't be quite as spontaneous as you could be in many other places. And this is just a street scene, and I want you to see that, you know, there's no street lights here, and there's a lot of chaos. There's things you could fall into. And so it's just a little bit more hazardous at night. So you have to make your transportation arrangements in advance. And obviously, you need to remain aware of your surroundings all the time and be attentive and do a little more legwork in terms of the planning. Accommodations are pretty, they're modest, but they're typically small hotels or guest houses. You're going to have a roommate. Sometimes you have to share a bed. They're usually California Kings. There would typically be air conditioning or a ceiling fan. The bathroom is almost always in the room. Where it's not in the room, we have one location we use. It's still a private bath. There's a door that shuts completely between you and anyone else, and it locks. It's just not physically in your room. So it's more like some dorms. Okay, so let me stop here and ask about questions. So I'll stop sharing here and see where everybody is. I'm not used to doing this anymore, so I'm not talking as fast and not covering as much ground. So I've got the chat open, and you can ask questions in the chat. You can unmute and speak up. Otherwise, I can go through a few more slides.
I had a question about the 6 to 9 credits thing.
That was for summer. And so for Intersession, you would only take one class. I just missed purging that. I'm sorry.
Okay, no, thanks. I was confused. That makes sense.
Yes. I was flying through this morning because I've had a really busy week, and I just didn't catch the, oh yeah, it's not summer. Any other questions? Okay. Okay. So why might you not want to study abroad in a developing country? It's really different, and some people find that stressful for all kinds of reasons. Most notably, the thing I want people to know, I've had 2 experiences where I really felt that the study abroad experience in Ghana may have worsened an existing mental health issue. Most people find some of the challenges energizing and motivating, but there are people for whom it's not. And that's mostly what I want to say here. So whereas if you go to a humanities program in Europe, you're going to be seeing beautiful architecture and works of art and going to concerts and things like that. And we do see really hard things in Ghana. We see poverty, we see sickness, we see disability, and that can be really difficult. Most people find it actually very uplifting because you get to see human resilience. You get to see people who are amazingly creative and persistent despite enormous challenges. But it can be hard at times. There are definitely different health risks. So everywhere you turn, there are these giant gutters that are just part of the structure of the streets. And obviously it takes some getting used to that. You've got to be on the lookout for a place that you might step into suddenly. So again, the accommodations and facilities are comfortable, but they're definitely modest, no 5-star hotels. And services and safety infrastructure are not as widespread. Services are less reliable. You have to be able to go a day without internet or without cell phone service. Safety infrastructure that's widespread here is just not as widespread. So looking at this street, there's no traffic lights. There's very few street lights. There is no lane markers. There's no crosswalks. So what that means is that you really do have to be thoughtful about your own safety. I do like to say that you really kind of need to be fit. This might be extreme. We don't do this every day, but we do a lot of walking in hot weather. January is going to be the hottest month. Normally in the summer, that's actually a little cooler there. Some special diets can't be accommodated. The food is wonderful, and it's just not always easy particularly for vegetarians, but for a couple of other vegans, I think, especially, but a couple of other possible diets too. And so want to see your grades if you were in your first semester in the fall. Next fall, be worried about that. Maximum of 16. And I do look at GPA, essay, and disciplinary record, but with modest expectations for each. So for GPA, I'm mainly worried that you can pass the course. I don't want you to spend this much money and struggle to pass. And then for the disciplinary record, the main thing we're looking for there, and Emily can add to this because she's the one who would actually see it, not me, is any indication that you might be a danger to self or others. And in practical terms, the most important thing for Ghana is anything drug related can be a problem because the drug laws are really draconian there. Underage drinking is less of a concern because the drinking age is 18. So the main thing I would be concerned about with drinking would be that you remain able to make good judgments about your environment. More questions?
Because I know there's a couple different regions that students will travel around. I didn't know if you wanted to hit on some of the places that you're planning on the
Yes, that's a good point. I don't have a map handy. So we would be, because of the shorter time frame than we've had in the summer, we would be eliminating northern Ghana, which is one of the 4 regions we've gone to in the past. So typically the itinerary has been 4 weeks, 4 regions. And it looks like Emily might be. So can you see my cursor here? Probably not, right?
I can't, but I can certainly, if you tell me the cities,
Okay.
I remember the general loop.
Okay, so we would be going to Accra and Kumasi, which are the 2 largest cities, and Cape Coast, and probably spending about a week in each. We also have a site that is, if you go to Koforidua, which is north of Accra, and then go over to the long finger-like projection off of the Volta Lake there. We go to a place called Pong that's on there.
That one?
No, it's down further. It's
right here.
Yep, right there. And we go to various things around each of them. So we're not necessarily in the city all the time when we go to the city. And as I said, January is hot. So one of the concerns in the north would be heat and dust. So questions? Let me get the... Anybody vegetarian and want to talk more about that piece?
I'm not strictly vegetarian, but I don't eat a lot of meat. So I would like, yeah.
So the challenges for vegetarians are that I can't guarantee that anything is free of, the sort of hidden things like chicken broth or shrimp powder. So if you're really that strict, I can't guarantee that you can maintain that level of avoidance. There are bean dishes that are common. There you can get lots of eggs. The other challenge for vegetarians is monotony, because there aren't quite as many choices that are vegetarian friendly. So if you're willing to go at the level of no visible meat, you'll do fine, especially if you can eat eggs. If you want assurances that every single thing is vegan, can't do it.
I think also, you have to eat the meat and try the food, the culture.
Yeah. Yeah, trying the culture. Food is an important part of culture. And one of the challenges there is that it's very hard in a region where people have historically been protein deficient. And the first thing they do when they get some money is buy themselves some meat. They can't imagine why somebody who has enough money to travel halfway around the globe would reject meat.
Just want to point out a couple things real quick on our website.
Yeah, so you want to show the application?
Yes, yeah. So I just want to point out the COVID-19 FAQ page, which is a really good resource. Like Professor Bandoni Muench said, it's very likely that you're going to be required to get the COVID-19 vaccine. So if you have the opportunity to get it, take advantage of that. But we are closely monitoring what the CDC is saying, the Department of State is saying, related to various countries around the world where we'll be sending students. And Ghana has been faring very well, despite this global pandemic, better than the U.S. So that's something that we're going to be watching. But if you were to apply, the application is open, and there's a $20 application charge. If you were to apply and for some reason, if we were to cancel the program, we would refund that application charge to you. So you can apply at no risk. And as well as same with the deposit. If you were to make the deposit, pay the deposit on the program, and we were to cancel the program, that would also be refunded to you. So there's some really good resources. There's a good little assessment tool on here where you can gauge what is your risk tolerance for study abroad during this time period. So I think that's a really cool tool. The scholarship information that we were referring to can be found here, including the Winter Intersession Scholarship and the Gilman Scholarship. And then if you click on search programs, that does take you to our program page for Ghana. And it has all the information, including the program dates, which is December 30th through January 24th. And the cost sheet that Professor Bandoni Muench was referring to in more detail, it's laid out here, and happy to answer any questions if you have any questions about the cost for this program. And finally, you can see the application deadline is October 15th, and it is a rolling application. And I thought this application was open, and it doesn't look like it is. So I'm going to make sure after this call that it is open. And it is a rolling application, and we always encourage students to apply early for planning purposes. The earlier you apply, certainly it'll make it easier for us to start putting plans in place to make this program happen.
And we get more for our money when we can start the planning early.
Yeah, exactly. So I did want to share those resources with you guys.
Yes, that's great. So who wants to go? all things being equal.
I'm going to drop my email so you have my contact information as well as Professor Bandoni Muench's.
Does anybody have questions? Has anyone talked with family yet about study abroad?
I have, but I didn't expect it to be back so soon.
Same.
Yeah. Yeah. Well, there is some danger it may not be, but we're going to do our best. And I think all things considered, at some point, people will start feeling a little safer moving around again.
Mm-hmm. Yeah, those vaccines are certainly one way to allow for that. So I think once now that it's a reality, it certainly allows us to envision study abroad a little easier and international travel.
So is malaria like a huge risk to students there? How does that work?
So it is, I've never had anyone in the program get malaria, but malaria is potentially fatal. So you do need to take it seriously. I have worked when I first started taking students, which was more than 10 years ago, I worked with a facilitator in country, and that person had worked with programs where students got malaria and where a couple of students had actually died from malaria. So it is serious. You do need to take the preventive medicine, but the preventive medicine is affordable and it is effective, even if it's kind of like the COVID vaccine in the sense that even if you were to get malaria, if you were taking the preventive medicine, it would be much milder and you would be far less likely to wind up in the hospital. So.
And we do have international health insurance that's included in all of our programs. So that covers everything from your standard doctor's visit to a hospitalization. It works a little differently in the developing world. Sometimes there's possibilities that you might have to pay for some things out of pocket and be reimbursed by the health insurance company, but you will be covered through health insurance.
One of Ghana's chief problems in terms of medicine is brain drain. And the reason for that is their doctors and nurses pass the licensing exams in the US and in the UK and other English-speaking countries very easily. And so what that tells you is that the education is on par with the education here and the quality of care. I got sick. I wound up in the hospital in Ghana at one point, and I took my notes from the hospital to my primary care doctor when I got back, and she told me that everything they did was exactly what would have been done in a US hospital. So.
What's your favorite part of the trip?
I hate that question because there's really, I like everything we do. Each experience is unique, and even places I've been to many times sometimes are very different on different trips and with different people. I definitely like getting outdoors. I love some of the market experiences because it's just so dynamic and energetic. It's such a sensory overload.
I feel like I always hear from our groups that have gone in the past, always have heard good baboon stories with encounters with the baboons.
Yeah, Shy Hills, they're not quite as acclimated to humans, so you see them from a distance. In the north is where you get, like I had a baboon steal a mango out of my hand. So that was a little scary actually, because they're big.
And here you have, I think in the north, you had the sling shots for the baboons to keep them away.
Yeah.
How would our grades like be assessed? I'm assuming it's not like exams and stuff.
I've done a mix of different things. I usually do a paper.
Okay.
I have done some quizzes or tests. And I'm not quite sure how it will work with Intersession. I've generally given people a window of time after they get back to do the paper, because it is sometimes hard to do online research there because our internet is a little spotty. So I might have to do some adaptation, either in providing more references up front so people can work on their papers, or something along those lines for this time around.
Okay, thank you.
But it tends to be writing and reflective writing.
Well, if there's no other questions, I want to thank you all for joining us. And like I said, I dropped our email addresses if you have any questions.
Yes, and we're both, just to point out that both of us use an email that doesn't match our name for the same reason, starting at the college before getting married. But it just makes it a little bit more confusing, and it's a double whammy this time.
Will we have access to the PowerPoint slides? Or
I can give you access, yeah.
Okay, perfect.
And this recording will be uploaded to the program page sometime next week, at some point next week. So if you also want to share the recording.
Okay, thank you.
Do you think your family, have any of you raised the question of going to Africa with your family?
I haven't. I feel like they'll be a little taken aback, maybe.
That's pretty common. And I do recommend pointing out that in terms of travel safety, historically at least, and now it's a mess because of COVID, but generally Ghana has been in the same category as Canada, as opposed to Mexico, as opposed to France, and various European countries. I think the UK is also in a higher risk category. So it's actually one of the few study abroad programs that Geneseo has that's in a level 1 country.
Yeah, it's a lot of street smarts, right? It's watching for traffic. It's watching your surroundings like you would in any big city.
Yeah, don't count your money publicly. If someone says don't go to that neighborhood after dark, you kind of trust their suggestion. Those kinds of common sense things. Okay, so I'd like to thank you all for coming, and I hope to talk with you again, and please let me know if you have more questions or if you want to get more information for sharing with family.
Thank you.
Thank you.
Thank you.
Thank you.
You're welcome.